Basics of Medical Biochemistry. First edition, 2022. Chapter 5. Chemistry of Lipids. Part 1 of 2. By Professor Dr. Muhammad Jawad. MBBS, Tau, M.Phil Philosophy, Ph.D, Dip M.E. Head of the Biochemistry Department-Fazaia Ruth Pfau Medical College-PAF Base Faisal-Karachi-Pakistan. Ex-Professor of Biochemistry, Qassim University Kingdom of Saudi Arabia. Ex-Professor, Head of the Biochemistry Department and Vice Principal. Liaquat College of Medicine and Dentistry and Fatima Jinnah Dental College, Karachi, Pakistan. Chapter 5. Chemistry of Lipids. 5.1 Introduction. Lipids are naturally occurring heterogeneous groups of compounds, insoluble in water, hydrophobic, but soluble in organic solvents like acetone, alcohol, benzene, chloroform, etc. They include the esters of fatty acids or substances capable of forming such esters that are utilizable by living organisms. Fats, oils, fatty acids, and cholesterol are well-known examples of lipids. Basic concepts. Lipids are compounds of carbon, hydrogen, and oxygen having comparatively less proportion of oxygen than carbohydrates and proteins. They are highly heterogeneous as have no basic structural unit as well as possess large variations in their sources, structures, properties, functions, utilization, requirement, and chemical reactions. Lipids are a large constituent of our diet. An integral component of the cell membrane of cell organelles and cytoplasm. Caloric value equals 9.3 kcal/g. Regarded as stored/reserved form of energy. Stored in adipose tissues. Brain and nerves are rich in lipids. Vital organs are enveloped by lipids. Act as thermostatic components. They insulate the body and protect various internal organs from the changes in temperature of the external environment. They supply essential fatty acids and fats-soluble vitamins such as vitamins A, D, E and K. Essential fatty acids are needed for normal growth and development. Lipid derivatives are precursors for other essential biomolecules. For example, acetic acid, which is the breakdown product of fatty acid, can be used for the synthesis of several complex molecules like cholesterol and sex hormones. In combination with carbohydrates and proteins, they form glycolipids and lipoproteins. Lipoproteins are the moving fuel in the body, such as high-density and low-density lipoproteins. Nerve fibers are enveloped by a myelin sheath which is made up of lipids. 5.2 Fatty acids. A fatty acid may be defined as an organic acid that occurs in a natural triglyceride, and it is a monocarboxylic acid ranging in chain length from C4 to about 24 carbon atoms. Fatty acids are obtained from hydrolysis of fats. General formula is RCOOH. Figure 5.1 General formula of fatty acid. They occur mainly as esters in natural fats and oils, but do also occur in the unesterified form as free fatty acids, representing a transport form in the plasma. Most of the fatty acids found in natural fats are usually straight-chain derivatives containing an even number of carbon atoms. The chain may be saturated, containing no double bond, or unsaturated, containing one or more double bonds. 5.2.1 Classification of fatty acids. Depending upon the total number of carbon atoms, there are two classes of fatty acids. 1. Even-chain fatty acids. They have carbon atoms 2, 4, 6, and so on. Most of the naturally occurring lipids contain even-chain fatty acids. For example, palmitic acid, 16C, and stearic acid, 18C. 2. Odd-chain fatty acids. They have carbon atoms 3, 5, 7, etc. Odd-numbered fatty acids are seen in the microbial cell wall. For example, pentadecanoic acid, 15C, and heptadecanoic acid, 17C. Depending upon the length of the hydrocarbon chain, there are three classes of fatty acids. 1. Short-chain fatty acid. These consist of 4 to 6 carbon atoms. 2. Medium-chain fatty acid. These consist of 8 to 14 carbon atoms. 3. Long-chain fatty acid. these consist of 16 or more, usually up to 24 carbon atoms. Depending on the nature of the hydrocarbon chain, there are 4 types of fatty acids: saturated fatty acids, unsaturated fatty acids, branched chain fatty acids, hydroxy fatty acids and cyclic fatty acids. 1. Saturated fatty acids, they do not contain double bonds in their structure. The general formula is CnH2n plus 1 COOH. Saturated fatty acids may be predicted based on acetic acid, CH3COOH, as the first member of the series in which methylene group, CH2, is progressively added between the terminal methyl, CH3, and carboxyl, COOH, groups. Fatty acids in biological systems usually contain an even number of carbon atoms, typically between 14 and 24. Palmitic acid and stearic acid are the most common fatty acids in humans. The hydrocarbon chain is almost invariably unbranched in animal fatty acids. A few branched chain fatty acids have also been identified both in plants and animals. The symbol of saturated fatty acid has 2 digits. The first indicates the total number of carbon atoms, while the second digit represents the position of the double bond, which is always 0, as there is no double bond in saturated fatty acids. Table 5.1 Important saturated fatty acids. Number of C atoms. Common name. Systemic name. Formula. Symbol. 2. Acetic acid. Ethanoic acid. CH3COOH. 2:0. 4. Butyric acid. Butanoic acid. CH3, CH2, 2COOH. 4:0. 6. Caproic acid. Hexanoic acid. CH3, CH2, 4COOH. 6:0. 8. Caprylic acid. Octanoic acid. CH3, CH2, 6COOH. 8:0. 10. Capric acid. Decanoic acid. CH3, CH2, 8COOH. 10:0. 12. Lauric acid. Dodecanoic acid. CH3, CH2, 10COOH. 12:0. 14. Myristic acid. Tetrahedroic acid. CH3, CH2, 12COOH. 14:0. 16. Palmitic acid. Hexadecanoic acid. CH3, CH2, 14COOH. 16:0. 18. Stearic acid. Octadecanoic acid. CH3, CH2, 16COOH. 18:0. 20. Arachidic acid. Eicosanoic acid. CH3, CH2, 18COOH. 20:0. 2 unsaturated fatty acids, they have one or more double bonds in their carbon chain. Unsaturated fatty acids are further divided into monounsaturated fatty acids and polyunsaturated fatty acids. Monounsaturated, monoethanoid, mononoic acids, they have one double bond. Their general formula is CnH2n1COOH. Examples: palmitoleic acid, oleic acid, etc. 2 polyunsaturated, polyethanoid, polyenoic acids, they have 2 or more double bonds. Examples: linoleic acid, arachidonic acid, etc. The double bonds in polyunsaturated fatty acids are separated by at least one methylene group. 3 branched chain fatty acids. Branched chain fatty acids are primarily saturated fatty acids with a methyl branch on the carbon chain. These may be even or odd chain fatty acids, but even chain fatty acids are predominant. They are categorized as mono-di- or multi-methyl types of branched chain fatty acids. In the monomethyl type, the predominant branching is near the terminal end of the carbon chain. For example, phytanic acid is present in butter. Sebum also contains branched-chain fatty acids. 4 hydroxy fatty acids, these are derivatives of saturated or unsaturated fatty acids with or without branches containing a hydroxyl group at one or more positions. Ricinoleic acid is an example of unsaturated hydroxy fatty acid. 5 cyclic fatty acids, these fatty acids bear cyclic groups. They belong to an unusual class of minor fatty acids generally produced by bacteria and less frequently by plants. Examples are hydrocarpic acid and chalmogric acid. They were earlier used in the treatment of leprosy. 5.2.2 Nomenclature of fatty acids. The systematic name for a fatty acid is derived from the name of its parent hydrocarbon by the substitution of OIC for the final E. For example, the 16 carbon-containing saturated fatty acids are called hexadecanoic acid because the parent hydrocarbon is hexadecane. Similarly, an 18 carbon unsaturated fatty acid with one double bond is called octadecanoic acid. The same chain length fatty acid with 2 double bonds is named octadecadianoic acid, and with 3 double bonds, octadecatrianoic acid. The notation 18:0 denotes an 18 carbon fatty acid with no double bond, whereas 18:2 indicates that there are 2 double bonds. Carbon atoms are numbered from the carboxyl carbon, first carbon. The carbon atoms adjacent to the carboxyl carbon, NOS2, 3, and 4, are also known as the alpha, beta, and gamma carbons, respectively, and the terminal methyl carbon is known as the omega or N carbon. The position of a double bond is represented by the symbol delta, followed by a superscript number. For example, 9 indicates a double bond between carbon number 9 and 10 of the fatty acid. The omega numbering system is another way to indicate the position of a double bond by counting from the distal end, with the omega carbon atom, the methyl carbon, as number 1. For example, omega 3 indicates a double bond on the third carbon counting from the omega carbon, i.e., methyl terminal side. On this pattern, fatty acids are recognized as omega family. Table 5.2 Important unsaturated fatty acids. Number of C atoms. Common name. Systemic name. Formula. Family. Symbol. Mononoic acids, fatty acids having one double bond. 16. Palmitoleic acid. Cis-9-hexadecanoic acid. C15H29COOH. Omega 7. 16:1, 9 or 16:19. 18. Oleic acid. Cis-9-octadecanoic acid. C17H33COOH. Omega 9. 18:1, 9 or 18:19. 18. Elatic acid. Trans-9-octadecanoic acid. C17H33COOH. Omega 9. 18:1, 9 or 18:19. Dianoic acids, fatty acids having 2 double bonds. 18. Linoleic acid. All cis-9,12 octadecadianoic acid. C17H31COOH. Omega 6. 18:2, 9,12 or 18:2, 9,12. Trianoic acids, fatty acids having 3 double bonds. 18. Alpha-linolenic acid. All cis-9,12, 15 octadecatrianoic acid. C17H29COOH. Omega 3. 18:3, 9,12, 15 or 18:3, 9,12, 15. 18. Gamma-linolenic acid. All cis-6,9,12 octadecatrianoic acid. C17H29COOH. Omega 6. 18:3, 6,9,12. Or 18:3, 6,9,12. Tetraenoic acids, fatty acids having 4 double bonds. 20. Arachidonic acid. All cis-5, 8, 11, 14 icosahexaenoic acid. C19H31 COOH. Omega-6. 20:4, 5, 8, 11, 14 or 20:4, 5, 8, 11, 14. Note: oleic acid and oleic acid have the same formula, but oleic acid is cis while oleic acid is trans fatty acid. 5.2.3 Essential fatty acids, EFAs, the group of polyunsaturated fatty acids that are not synthesized in the body but are necessary for normal growth and development. These are three in numbers: linoleic acid, linolenic acid and arachidonic acid. Linoleic acid is the most important that can among the others. It has been observed that linoleic acid can be converted into linolenic acid and arachidonic acid if it is present in a sufficient amount in the body. Pyridoxine, vitamin B6, helps in the process of interconversion. Essential fatty acids can be classified as belonging to one of two families: the omega-6 family, linoleic acid, gamma-linolenic acid, arachidonic acid, or the omega-3 family, alpha-linolenic acid. Fatty acids belonging to these two families are different in their chemistry as well as in their natural occurrence and functions. Essential fatty acids must be supplied to the diet. They are regarded as structural elements of tissues and components of membranes. A lack of essential fatty acids in the diet can produce growth retardation and other deficiency symptoms. Figure 5.2 The essential fatty acids. Functions of essential fatty acids. Essential fatty acids in the diet establish and maintain body health by providing energy and increasing stamina. They enhance thermogenesis, help build muscle, prevent muscle breakdown and speed up the recovery from fatigue and illness. EFAs make hormone-like substances such as eicosanoids that regulate immune and inflammatory responses. They decrease risk factors for cardiovascular disease, as they lower serum cholesterol and increase HDL levels. Improve brain function, mood, intelligence, behavior, and vision. EFAs are important components of the entire nervous system, as more than 60% of the brain is fat. Arachidonic acid is an important precursor for prostaglandins, thromboxanes, and leukotrienes. They are necessary to make the neurotransmitter serotonin. Prevent fatty liver formation. EFAs help keep the energy up and suppress appetite, thereby aiding in weight loss. They are necessary for the production of adrenal, thyroid and sex hormones. EFAs are necessary for cell growth and division. They have antifungal, anti-yeast, and antimicrobial properties and thus protect against infections. EFAs aid in the transport of minerals that keep bones and teeth strong, and aid to prevent osteoporosis. 5.2.4 Physical properties of fatty acids. The characteristic molecular structure and configuration contribute to many distinct physical properties associated with fatty acids. These include the melting and solidification phenomena, boiling point, isomerism, and solubility behavior of fatty acids. 1. Melting points of fatty acids. The values of melting points of the fatty acids are concerned with the chain length and presence of many double bonds. The higher the chain length and higher the degree of saturation, the higher will be the melting points. Short and some medium chain fatty acids from C4-C10 are generally liquid at room temperature, while higher chain fatty acids are solids. Table 5.3 Melting points of some fatty acids. Fatty acid. Chain length. No of carbon atoms. No of double bond, S. Melting point. Butyric acid. 4. 0. 8 degrees C. Palmitic acid. 16. 0. 62 degrees C. Oleic acid. 18. 1. 14 degrees C. Linoleic acid. 18. 2. 5 degrees C. Linolenic acid. 18. 3. 10 degrees C. Arachidonic acid. 20. 4. 50 degrees C. 2. Isomerism in fatty acids. saturated fatty acids exist as straight-chain molecules, sometimes they may be branched. They are always without a double bond. The isomerism that exists in unsaturated fatty acids is due to the presence of a double bond. Configuration of the double bonds in unsaturated fatty acids. The cis or transgeometric isomerism is found in the carbon chain where a double bond exists. In the case of the cis isomer, the groups attached to the carbons of the double bond are on the same side. If the two groups lie on opposite sides of the double bond, then the isomer is transform. The cis configuration does not allow free rotation around the double bond and produces a rigid bend or kink at the carbon chain of the molecule. The configuration of the double bonds in most unsaturated fatty acids is cis. However, few transforms do exist in some natural and partially hydrogenated fats and oils. Figure 5.3 The cis and transgeometric isomerism at the double bond. Vegetable oils have many double bonds in their hydrocarbon chain, causing fatty acids to remain liquid at room temperature. The membrane lipids are rich in unsaturated fatty acids, which help them to remain fluid at all environmental temperatures. The hydrocarbon chains in saturated fatty acids are fairly straight and can pack closely together, making these fats solid at room temperature. An increase in the number of cis double bonds in a fatty acid led to a variety of possible spatial configurations of the molecule. For example, arachidonic acid with 4 cis double bonds has apparent kinks or a U shape. Naturally occurring unsaturated vegetable oils have almost all cis bonds, but during cooking, some of the cis bonds are converted to trans bonds. Many foods contain trans fatty acids, as well as they are derived from the saturation of fatty acids during hydrogenation or hardening of natural oils in the manufacture of margarine. 3. Solubility of fatty acids. In the body, fatty acids are found as portions of large molecules such as triacylglycerols or phospholipids. Free fatty acids consist of a long tail made up of a hydrocarbon chain. The tail is not water-soluble but dissolves well in fat and oil. The hydrophilic property of fatty acid is provided by the terminal carboxyl group, after being ionization to Cu at normal physiological pH. The hydrocarbon chain being nonpolar is responsible for the hydrophobic property of a fatty acid. So, the solubility depends upon the ratio between the polar hydrophilic carboxyl group and the nonpolar hydrophobic hydrocarbon chain. As there is only one carboxyl group, the extent of solubility is decided by chain length and degree of saturation. Solubility is more in short-chain fatty acids with a greater number of double bonds. The solubility of the fatty acids is also affected by temperature, it increases with an increase in temperature. 5.2.5 Chemical properties of fatty acids. Most of the chemical properties of fatty acids are exhibited by unsaturated fatty acids, owing to the presence of a double bond. 1. Hydrogenation. The addition of hydrogen to unsaturated fatty acids converts them into saturated fatty acids. 2. Halogenation. Different halogens like chlorine or bromine can be added to unsaturated fatty acids. This addition reaction provides a reliable index to determine the degree of unsaturation of fatty acids. 3. Oxidation. Unsaturated fatty acids can undergo oxidation more easily than saturated fatty acids because they contain multiple double bonds. A variety of substances are produced as a result of the oxidation of fatty acids. Lipid peroxidation refers to the oxidative degradation of lipids. It is the process in which free radicals take electrons from the lipids in cell membranes, resulting in cell damage. This process is preceded by a free radical chain reaction mechanism. Some of the end products of lipid peroxidation may be mutagenic and carcinogenic. Another end product, malondialdehyde, reacts with deoxyadenosine and deoxyguanosine in DNA to form DNA adducts, a form of DNA damage. 4. Formation of salts. On reaction with alkali, fatty acids form salts which are used as soap and emulsifying agents. Figure 5.4 Reaction of fatty acid with alkali, sodium hydroxide, to form soap and glycerol. 5. Formation of detergents. These are the sulfated or sulfonated forms of alkyl alcohols that are obtained by the reduction of the carboxyl group of fatty acids. Detergents are more powerful emulsifiers and cleansing agents than soaps. They can work even in hard water. 6. Formation of esters. The ester is an organic compound formed from an alcohol and an acid by splitting out a molecule of water. The water is formed from the H of the alcohol and O of the acid. The carboxyl group, COOH, of fatty acid reacts with an alcohol, RO, to form a product known as an ester, RCOR. Water is released during this reaction. Figure 5.5 Esterification of fatty acid. 3 ester bonds are found in the molecule of triacylglycerol, each between the carboxyl group of fatty acid and O group of glycerol. 7. Formation of eicosanoids. Eicosanoids are produced by the enzymatic or non-enzymatic oxidation of arachidonic acid, a 20-carbon polyunsaturated fatty acid. Eicosanoids are divided into many distinct families like prostaglandins, prostacyclins, thromboxanes, and leukotrienes. These are signaling molecules and may also act as endocrine agents to control the function of distant cells. 5.3 Classification of the lipids. Lipids are broadly classified as simple, complex, or compound and derived lipids. 5.3.1 Simple lipids. These are esters of fatty acids with alcohol. Simple lipids can be divided into 2 categories as neutral fats and waxes. 1. Neutral fats or triglycerides or triacylglycerols, tag. These are esters of fatty acids with glycerol. They are colorless, odorless, and tasteless substances. Each molecule of triacylglycerol or triglyceride is composed of 3 fatty acids and 1 trihydric alcohol, i.e., glycerol. Some are solid at room temperature while others are liquid. Liquid forms are referred to as oils. They are richly present in nuts, seeds, and fat depots of animals, red meat and fatty fish. Figure 5.6 Formation of triglyceride, triacylglycerol, molecule from glycerol and fatty acids. 2. Waxes. These are esters of fatty acids with alcohol other than glycerol. Waxes are semi-solid substances, composed of long-chain fatty acids and higher monohydroxy alcohol. Ear wax is secreted by special skin glands of the auditory canal. It does trap dust and other small particles and prevents them from reaching, and potentially damaging or infecting the eardrum. Other examples of wax include beeswax and carnauba wax. They can take up water without getting dissolved in it. They are used as bases for the preparation of cosmetics, ointments, polishes, lubricants, and candles. In nature, they are found on the surface of plants and insects. Waxes are of no nutritional value, as not hydrolyzed by lipase. 5.3.2 Compound or complex lipids. They are composed of fatty acids, alcohol, and some other group, and upon hydrolysis, they yield free fatty acids, alcohol, and some other group. Important types of compound lipids are phospholipids, sulfolipids, glycolipids, lipoproteins, etc. 1. Phospholipids. They are composed of fatty acids, alcohol, and phosphoric acid. They are modified fat in which phosphate replaces one of the fatty acid chains. Upon hydrolysis, they yield fatty acids, alcohol, and phosphoric acid. Based on the alcohol present, they are further divided into glycerophospholipids and sphingophospholipids. A. Glycerophospholipids. They are composed of glycerol, fatty acid, and phosphate group. Also known as phosphoglycerides or glycerol phosphatides. Sometimes they also contain nitrogenous base in their molecule. They act as good emulsifying agents. Glycerophospholipids are regarded as essential constituents of cellular structures and prevent rapid mobilization in a starving condition. Following are the types of glycerophospholipids. Iphosphatidic acids. It is the phosphorylated form of triacylglycerol, formed when one of its fatty acids is replaced by phosphate. Phosphatidic acid consists of a glycerol backbone, with a saturated fatty acid bonded to carbon number 1, an unsaturated fatty acid bonded to carbon number 2, and a phosphate group bonded to carbon number 3. Phosphatidic acid acts as a lipid messenger that has been shown to increase muscle protein synthesis. It is regarded as a precursor for all other glycerophospholipids. Figure 5.7 Structure of phosphatidic acid. 2. Phosphatidylcholine, lecithin. It is composed of fatty acid, glycerol, phosphate, and choline, nitrogenous base. This type of glycerophospholipid is the most abundant phospholipid in the cell membrane. They are widely distributed in the body, particularly rich in the liver bile and also present in plasma. They are powerful emulsifiers for fat before digestion. They help to keep cholesterol in a dissolved state and prevent the accumulation of fats in the liver. They represent a large proportion of the body's content of choline. Choline is important in nervous transmission, as acetylcholine, and as a store of label methyl groups. Nutritional sources of phosphatidylcholine include eggs and soybeans. One large egg contains an average of 147 mg of phosphatidylcholine. A group of phospholipases is involved in the digestion of phospholipids including glycerophospholipids. Snake venom contains lecithinase. Clinical aspects: dipalmitoyl lecithin is a very effective surface active agent and a major constituent of the surfactant preventing adherence, due to surface tension on the inner surfaces of the lungs. Its deficiency in the lungs of premature infants causes acute respiratory distress syndrome, ARDS. Since phosphatidylcholine might increase acetylcholine, there is interest in using it for improving memory and for conditions such as Alzheimer's disease. It can also support liver function and keeps a check on cholesterol levels. Figure 5.8 Structure of phosphatidylcholine, lecithin. 3-phosphatidylethanelamine, cephalin. This type of phospholipid is composed of fatty acid, glycerol, phosphate, and ethanolamine, nitrogenous base. Its structure is similar to lecithin with the exception that the base ethanolamine replaces choline. It occurs mostly with lecithin and it is more acidic than lecithin. It is particularly concentrated in brain tissues and also found in erythrocytes. It takes part in the process of blood coagulation. Figure 5.9 Structure of phosphatidylethanolamine, cephalin. 4-phosphatidylinositol. This phospholipid is composed of fatty acid, glycerol, phosphate, and inositol, hexitol. Similar in structure to lecithin, but nitrogen base is different, which is inositol. Occurrence and functions are also similar to lecithin. Phosphatidylinositol 4,5-bisphosphate is an important constituent of cell membrane phospholipids involved in metabolic processes. Upon stimulation by a suitable hormone agonist, it is cleaved into diacylglycerol and inositol trisphosphate, both of which act as second messengers for a variety of signaling pathways. Figure 5.10 Structure of phosphatidyllinositol. V. Plasmalogen. It is phosphatidylcholine or phosphatidylethanolamine with a vinyl ether linkage on the first O group of glycerol. The main difference between ether and ester lies in their structure. An ester group needs 2 oxygen atoms and 2 carbon atoms to complete its characteristic structure, while an ether group needs only 1 oxygen atom and 2 carbon atoms for its structure. These two features provide unique properties to these compounds. Plasmalogens are not hydrolyzed by phospholipases. Plasmalogens constitute about 10% of the phospholipids of the brain and muscle. These are also found in the heart, liver, and platelets. In most of the plasmalogens, the nitrogen base is ethanolamine. But in some instances, choline, serine, or inositol may be substituted for ethanolamine. Figure 5.11 Structure of plasmalogen. 6-phosphatidylglycerol. It is formed by esterification of phosphatidic acid with glycerol. Structurally it is a diphosphatidylglycerol, known as cardiolipin. It is a unique phospholipid that is almost exclusively located in the inner mitochondrial membrane where it is biosynthesized. Cardiolipin plays an important role in regulating various kinds of mitochondrial proteins such as electron transport complexes, carrier proteins, and phosphate kinases, and is also essential for the organization of particular mitochondrial structures such as cristae and contact sites. This is the only phospholipid with antigenic properties. Clinical aspect: cardiolipin antibodies are often high in people with abnormal blood clotting, autoimmune diseases like lupus, or repeated miscarriages. Figure 5.12 Structure of cardiolipin. 7-phosphatidylserine. This phospholipid found in most tissues, differ from phosphatidylcholine only in that the serine replaces choline. It covers and protects the brain cells and carries messages between them. Phosphatidylserine plays an important role in keeping the brain active and memory sharp. Food rich in phosphatidylserine are including soybeans, which is the main source, white beans, egg yolks, chicken liver, and beef liver. Clinical aspect: phosphatidylserine is found effective in the treatment of Alzheimer's disease, age-related decline in mental function, attention deficit hyperactivity disorder and depression. It is also used for improving thinking skills in young people, preventing exercise-induced stress, and improving athletic performance. Figure 5.13 Structure of phosphatidylserine. 8 Platelet activating factor, PAF. It is an ether glycerophospholipid, containing an unsaturated alkyl group in an ether linked to carbon number 1 and an acetyl residue at carbon number 2 of the glycerol backbone. It is synthesized and released by various cell types. PAF activates inflammatory cells and mediates hypersensitivity, acute inflammatory and anaphylactic reactions. It causes platelets to aggregate and degranulate, and neutrophils and alveolar macrophages to generate superoxide radicals. One of the examples of a platelet activating factor is 1-alkyl-2-acetylglycerol 3-phosphocholine. It has an alkyl group, generally 16 carbon, at position 1, the acyl group at position 2 is acetate and phosphocholine is present at position 3. Figure 5.14 Structure of platelet activating factor. B. Sphingophospholipid, sphingomyelins. It is composed of fatty acid, phosphoric acid, nitrogenous base, and sphingosine. Sphingosine, it is 18 carbon amino alcohol, 2 amino 4 transoctadecene 1,3 diol, with an unsaturated hydrocarbon chain. It forms the backbone of sphingomyelin. Figure 5.15 Structure of sphingosine. Ceramide, it is a sphingosine fatty acid complex. Ceramides are lipid molecules found in high concentrations within cell membranes in the upper layer of the skin. They have a significant dermoprotective role. They hold skin cells together, forming a protective layer that plumps the skin and holds moisture. They also act as a barrier against bacteria and environmental pollutants. Figure 5.16 Structure of ceramide. The alcohol group at carbon number 1 of sphingosine is esterified to phosphorylcholine to produce sphingomyelin. Sphingomyelin is an important component of the myelin of nerve fibers. It is richly found in the brain and nervous tissues, little amounts are found in other tissues. It does not contain glycerol at all. Figure 5.17 Structure of sphingomyelin. Lecithin/sphingomyelin, L/S, ratio. The L/S ratio in amniotic fluid is used for the evaluation of fetal lung maturity. Before 34 weeks gestation, lecithin and sphingomyelin concentrations are equal, but afterward, there is a marked increase in lecithin concentration. The normal range of L/S ratio is 1.5:1, which indicates adequate fetal lung maturity. Delivery of a premature, low birth weight baby with a low L/S ratio predisposes the child to acute respiratory distress syndrome. Functions of phospholipids. Components of the cell membrane, mitochondrial membrane, and lipoproteins. Provide barriers in cellular membranes, to create a stable barrier between two aqueous compartments. Participate in lipid absorption and transportation from the intestine. Play important role in blood coagulation. Required for enzyme action, especially in the mitochondrial electron transport chain. Phosphatidylcholine provides choline, which acts as a lipotropic agent. Membrane phospholipids act as a source of arachidonic acid. Act as a reservoir of second messenger, example phosphatidylinositol. Essential components of bile and exhibit detergent properties. Act as a cofactor for the activity of lipoprotein lipase during hydrolysis of lipids. Phospholipids of myelin sheath provide insulation around the nerve fibers. Dipalmitoyl lecithin, lecithin with 2 molecules of palmitic acid, acts as a surfactant in the lungs. 2 glycolipids, glycosphingolipids. They are composed of sugar, fatty acid, and alcohol, usually sphingosine, or they produce sugar, fatty acid and sphingosine on hydrolysis. In contrast to sphingomyelins, they are devoid of phosphoric acid and they have monosaccharides or oligosaccharides attached directly to ceramide by an O-glycosidic linkage. The polar properties confined to the head region are due to carbohydrate residues. The type of glycosphingolipid is determined by the number and type of carbohydrate moieties. Figure 5.18 Structure of glycolipid, galactocerebroside, a glycosphingolipid. There are two types of glycolipids, neutral glycosphingolipids and acidic glycosphingolipids. Neutral glycosphingolipids or cerebrosides, these are ceramide monosaccharides, that contain either a molecule of galactose, galactocerebroside, or glucose, glucocerebroside. Occur in large amounts in the white matter of the brain and spinal cord. Do not occur in the embryonic brain. There is no glycerol, no phosphoric acid and no nitrogenous base. Galactocerebroside is the principal glycosphingolipid in brain tissue and myelin, while glucocerebroside is a major constituent of skin lipids and is the source of the unusual complex ceramides that are found in the stratum corneum. It is also the biosynthetic precursor of the oligoglycosphingolipids. Ceramide oligosaccharides, globosides, have additional monosaccharides attached to the glucocerebroside. Most of these occur on the external leaflet of the plasma membrane as important components of the body's immune defense system. Lactosyl ceramide contains lactose, galactose and glucose attached to ceramide. It is a component of the erythrocyte membrane. Individual cerebrosides are differentiated based on the kind of fatty acids in the molecule. The following four types have been identified. Kerosene contains lignoceric acid. Cerebron contains cerebronic acid. Nervon contains nervonic acid. Oxynervon contains a hydroxy derivative of nervonic acid. Clinical aspects: in Gaucher's disease, harmful quantities of glucosylceramide, glucocerebroside, accumulate in the tissues of the patient. 2 Acidic glycosphingolipids, gangliosides. Gangliosides are sialic acid-containing glycosphingolipids. Richly found in the gray matter of the brain. They occur especially on the cellular surfaces of neuronal cells, where they form a complex pattern, but are also found in many other cell types. They are negatively charged at physiological pH. The negative charge is imparted by N-acetylneurominic acid or NANA, sialic acid. Brain gangliosides may contain up to 4 sialic acid residues, and based on that they are designated as GM, GD, GT, and GQ, containing 1, 2, 3 or 4 sialic acid residues. 4 important types of GM series are GM1, GM2, GM3, and GD3. GM1 is complex of all, found in the intestinal cell membrane. It provides a site for the attachment of cholera toxin. Some glycolipids are involved in the antigenicity of blood group factors, while others bind to specific toxins or bacteria. They occur particularly in the outer leaflet of the plasma membrane, where they contribute to cell surface carbohydrates. They act as cell surface receptors for various hormones and growth factors. They play important role in cellular interactions, growth, and development. 3 Sulfolipids, these are sulfate esters of glycolipids also known as sulfatides. Found in various tissues, example liver, kidney, testes, and brain. Richly found in the white matter of the brain. They are negatively charged at physiological pH. Failure of degradation causes them to accumulate in nervous tissues. Figure 5.19 Structure of sulfolipid. 4 Lipoproteins, these are formed when lipids are conjugated with proteins. Lipoproteins are complex particles that have a central hydrophobic core of nonpolar lipids, primarily cholesterol esters and triacylglycerols. This hydrophobic core is surrounded by a hydrophilic membrane consisting of phospholipids, free cholesterol, and apolipoproteins. Lipoproteins are involved in the structure and function of the cell membrane. They are important for lipid transport in the blood. They occur in milk, blood, egg yolk, cell membrane, and cell nuclei. The transmembrane proteins of the mitochondria are also lipoproteins. They are classified into 4 types according to the rate of flotation in sodium chloride after ultracentrifugation. Their types are chylomicron, very low density lipoprotein, VLDL, low density lipoprotein, LDL, and high density lipoprotein, HDL. The most abundant lipid constituents are triacylglycerols, free cholesterol, cholesterol esters and phospholipids, mainly phosphatidylcholine and sphingomyelin, fat-soluble vitamins, and antioxidants are also present in them. Chylomicrons are the highest lipid-containing lipoprotein while HDL has the least lipid. HDL is involved in reverse cholesterol transport, i.e., takes up cholesterol from non-hepatic, peripheral, tissues and returns it to the liver as cholesterol esters. Owing to this function, HDL is termed good cholesterol. Figure 5.20 General structure of a lipoprotein. Source: drlib.info. Apolipoproteins, apoproteins. Apolipoproteins are the components of different lipoproteins found on their surface. They made lipoproteins transportable, as the lipid components of lipoproteins are insoluble in water. They also can act as enzyme cofactors and cell surface receptor ligands for interaction with lipoprotein receptors in tissues, i.e., to recognize the cell membrane surface receptors. Most apolipoproteins are made in the liver and intestine, but a small amount of ApoB can be made in heart tissue and ApoE is made by macrophages. The distribution of apolipoproteins characterizes the lipoprotein. Without proper function of apolipoproteins in the body, a variety of disorders may appear. Following are the important types of apolipoproteins. Apolipoprotein A, found on HDL and chylomicrons, intestine/liver. ApoAI, activates lecithin cholesterol acyltransferase, LCAT, and is the ligand for HDL receptor. ApoA2, inhibits the LCAT enzyme. 2-apolipoprotein B, ApoB100, found on VLDL and LDL and is the ligand for LDL receptor, liver. ApoB48, found on chylomicrons, intestine. 3-apolipoprotein C, it is found on chylomicrons, HDL and VLDL, liver. ApoCI, activates LCAT. ApoC2, activates lipoprotein lipase. ApoC3, inhibits ApoC2. 4-apolipoprotein D, present on HDL and may act as lipid transfer protein. V-apolipoprotein E, it is found on chylomicrons, VLDL and HDL and acts as the ligand for lipoprotein remnant and LDL receptors, liver. Table 5.4 Composition, density, and source of lipoproteins. Apolipo proteins. A, C, E, B48. C, E, B100. B100. A, C, D, E. Table 5.5 Important lipoproteins. Type. Diameter. Nm. Features and function. Chylomicron. 100-500. It is a fat globule composed of protein and the main lipid is triacylglycerol, 88%. Lowest in density. Found in the blood and lymphatic fluid where they serve to transport fat from its port of entry in the intestine to the liver and adipose tissue. After a fatty meal, the blood looks milky, as it is full of chylomicrons. Very low density. Lipoprotein. VLDL. 3080. Size and lipid content, 60% triacylglycerol and 14% cholesterol, are smaller than chylomicron. Synthesized in the liver and transported endogenously synthesized triacylglycerol to the extrahepatic tissues. Low density. Lipoprotein. LDL. 18-28. Synthesized in blood, during the metabolism of VLDL. Small-sized. With 10% triacylglycerol and 45% cholesterol content. Regarded as bad cholesterol. High density. Lipoprotein, HDL. 5-15. Synthesized in the liver, have a very small size with the lowest lipid content. Transport cholesterol from the cells and tissue back to the liver. Good cholesterol. 5.3.3 Derived lipids. These are the hydrolytic products of simple and compound lipids. They include fatty acids, glycerol, other alcohols, sterols, steroids such as cholesterol and steroidal hormones, fatty aldehydes, ketone bodies, etc. Substances associated with lipids are also considered as derived lipids like carotenoids, fat-soluble vitamins A, D, E, K, and eicosanoids, prostaglandins, prostacyclins, thromboxanes, leukotrienes, lipoxins, and terpenes. Exercise questions. MCQ 1. A 19-year-old girl consulted a doctor for complaints about her unhealthy-looking nails, skin, and hair. After taking her history and general physical examination, the doctor suspected the deficiency of essential fatty acids in her diet. Which of the following fatty acids is suspected to be deficient in the diet of this patient? Butyric acid, linoleic acid, oleic acid, palmitic acid, stearic acid. MCQ 2. A 9-year-old boy was brought to NOPD by her parents, for the complaint of reduced hearing in her left ear. Examination of her left ear canal by otoscope showed excessive accumulation of wax. Which of the following types of lipids belongs to the substance found in excess in the ear canal of this patient? Derived lipid, lipoprotein, phospholipid, simple lipid, sulfolipid. MCQ 3. Which of the following dietary lipids is rich in the diet of an adult person? Cholesterol, cholesterol esters, free fatty acids, phospholipids, triacylglycerol. MCQ 4. Which of the following fatty acids should be taken in the diet to avoid deficiency of essential fatty acids? Arachidonic acid, butyric acid, oleic acid, palmitic acid, stearic acid. Please write answers in the comments. End of Part 1 of 2 of Chapter 5. Thank you.